Alright, this is Healthcare Bill part number 40, and we're going to start on page number 42. We're at section 2706, non-discrimination in healthcare. It's just 2 paragraphs long. Basically, from what I'm getting out of all this, and you can read the 2 paragraphs for yourself, is that a health insurance issuer, this would be whether your employer is providing you health insurance, whether it be Blue Cross Blue Shield or United Healthcare or what, it doesn't matter what company it is, it's providing this health insurance to you, okay? Or whether you buy a policy on your own, okay? Whoever is paying your medical bills, okay, cannot say, well, gee, you can't go to X and Y doctor. Yes, he's complying with all state regulations, but we aren't going to pay it anyway. They can't do that anymore. Now they can say, well, we're only going to pay a certain amount and you have to pay the rest, but they can't say we're not going to pay anything at all because this thing says that's illegal now. So there you go, there you have it in a nutshell. Alright, now we're going to go to section 2707. Comprehensive health insurance coverage. Coverage for essential health benefits package. A health insurance issuer that offers health insurance coverage in the individual or small group market shall ensure that such coverage includes the essential health benefits package required under Section 1302A of the Patient Protection and Affordable Care Act. Well, what you're reading here is the Patient Protection and Affordable Care Act. So, we have to find Section 1302. And I'm going to talk about this just a little bit more, and then I'm going to show you where Section 1302 is. Part B says cost sharing under group health plans. A group health plan shall ensure that any annual cost sharing imposed under the plan does not exceed the limitations provided for under paragraphs 1 and 2 of Section 1302C. Child-only plans. If a health insurance issuer offers health insurance coverage in any level of coverage specified under Section 1302D, the issuer shall also offer such coverage in that level as a plan in which the only enrollees are individuals who as of the beginning of the plan year, have not attained the age of 21. Then we have the dental only. This section shall not apply to a plan described in 1302D to B to 1. So where is this mysterious Section 1302? Well, if you will go down to page number 44, you find Section 1301. So what is a qualified health plan? Okay, in this title, in general, the term qualified health plan means that it is a health plan that has in effect a certification which may include a seal or other indication of approval that such a plan meets the criteria for certification described in Section 1311, issued or recognized by each exchange through which such plan is offered. And guess what? 1311 is a little further down. Provides the essential health benefits package described in Section 1302A, which we have to go a little bit further down, is offered by a health insurance issuer that is licensed and in good standing to offer health insurance coverage in each state in which such issuer offers health insurance coverage under this title. In other words, it's a licensed health insurance provider. Agrees to offer at least one qualified health plan in the silver level and at least one plan in the gold level in each such exchange. Agrees to charge the same premium rate for each qualified health plan of the issuer without regard to whether the plan is offered through an exchange or whether the plan is offered directly from an issuer or through an agent. So, in other words, the price that you pay at the state exchange will be the same price that you pay if you get the insurance directly from the company or you get the insurance from an individual agent. and complies with the regulations developed by the Secretary under Section 1311D and such other requirements as an applicable exchange may establish. And this thing just goes on and on. Inclusion of co-op plans and a community health insurance option. Any reference in this title to a qualified health plan shall be deemed to include a qualified health plan offered through the co-op program under Section 1322 or a community health insurance option under Section 1323 unless specifically provided for otherwise. Wow. And we're going to get into this a little bit later, but I think we should just go back. At least now you know where this Section 1301 is. And actually we were trying to refer to Section 1302, so let's go back down to Section 1302, which now you will find on page number 45. The Essential Health Benefits Package. In this title, the term Essential Health Benefits Package means, with respect to any health plan, coverage that provides for the essential health benefits defined by the Secretary under subsection B. We'll get into subsection B in a minute. Limits cost sharing for such coverage in accordance with subsection C. Subject to subsection E provides either the bronze, silver, or gold or platinum level of coverage described in subsection D. Okay, so we're going to be talking about the essential health benefits at long last. So, subject to paragraph 2, the Secretary shall define the essential health benefits except that such benefits shall include at least the following general categories and the items and services covered within the categories. These would be ambulatory patient services. So, if these guys are going to provide you health insurance, they've got to cover whenever you transport an ambulance. Emergency services, you go to the ER, they have to cover it. Hospitalization. Maternity and newborn care, so they can't say, well, you had a baby, that's not our problem. Health insurance can't do that anymore. Mental health and substance use disorder services, including behavioral health treatment. So if you have a mental health problem, they have to cover it. Prescription drugs, they have to cover it. Rehabilitative and habilitative services and devices. In other words, you get injured in a car wreck and you have to go through rehabilitation to get yourself fixed back up. They have to cover that now. Laboratory services, this is when you get your blood work. Preventive and wellness services and chronic disease management. They have to provide you with preventative services like, programs where they get you walking and healthy. It'd be really interesting if they provided you say, for preventative services, let's say you had to have running shoes. That would be kind of nice to see them provide the cost for running shoes. I doubt they'll do that, but that'd be kind of interesting if they did. Just a little something. Pediatric services, including oral and vision care. Alright, so if you enroll your kid in your health insurance, they have to provide dental care for the kid, and they have to provide vision care for the kid. Limitation: the Secretary shall ensure that the scope of the essential health benefits under paragraph 1 is equal to the scope and benefits under the typical Okay. The essential health benefits have to be equal to the scope of benefits provided under a typical employer plan as determined by the Secretary. To inform this determination, the Secretary of Labor shall conduct a survey of employer-sponsored coverage to determine the benefits typically covered by employers, including multi-employer plans, and provide a report on such survey to the Secretary. Wow. And that kind of goes on and on and on, and you can check this out for yourself. It goes from page 45 all the way down to... Wow, really, it just goes on and on and on. And we'll cover all this, no question about it. It's just like, whoa. I don't know if we'll cover it in this video, but we'll definitely cover it. And it looks like it's going to go all the way down. It's going to go all the way down to page 50. So anyway, now you have a basic idea of what's going on. I'm going to go ahead and go back to page number 40. I think we're going to go back to page number 43. As we just covered 2706. And we just covered section 2707. I guess I'll go ahead and cover section 2708. Prohibition on excessive waiting periods. A group health plan and a health insurance issuer offering group or individual health insurance coverage shall not apply any waiting period as defined in that exceeds 90 days. Okay, so they can't make you wait more than 90 days to get coverage of any kind. And that's what that's saying. All right. That's Healthcare Bill part number 40. I will cover the next part in my next video, so stay tuned.